Hi, everyone, and thank you for tuning into episode 4 of the Real Heroes Don't Wear Capes podcast. I'm Stephanie Carter, here with Crystal Sutherland from the HS Heroes team, and today we are joined by special guest, Dr. Jaggi Rao. Dr. Rao, would you like to introduce yourself to the HS Heroes community?
Thanks so much, Stephanie, and thank you, Crystal, for having me today. My name is Jaggi Rao. I'm a dermatologist practicing in Edmonton, Alberta. My practice is a busy one right in the heart of the city. I'm a university professor at the University of Alberta, where I teach dermatology, and I see a number of medical patients, some aesthetic patients, and laser patients, surgical patients, all related to skin. I even do clinical research and teledermatology.
Thank you, Dr. Rao. We thought we could start with you telling us a little bit about consult derm and how it can benefit patients as well as doctors who are unfamiliar with the spectrum of dermatological conditions.
Sure. Yeah. Consult Derm is a store and forward platform. It's a web-based program that I helped to create probably about 15 years ago that well before the pandemic has been helping physicians across the country as a clinical assistance tool. So essentially, if you went to your family doctor and he wasn't sure what you had or how to treat it, he could take some photographs of your skin problem and then put a little brief history and send it to a dermatologist like myself and my team. And then we'd be able to tell them what we think it is, a little educational note for both him, her, or you, and all of the above, and also a management suggestion plan. So for example, if you had some painful boils under your arms or in your groin, you could go and see your family doctor and maybe even emergency physician. They'd take the photos and the history, send it to us, and we'll say, you know what, we think this is probably HS, Hidradenitis Suppurativa, give a little educational note what it is, and then suggest to them how to treat it. So it's been found to avoid the delay of seeing a dermatologist to make the diagnosis, and people get board certified dermatologist specialty care right away.
Sorry, this isn't available in all provinces yet, is it?
No, it's available in Alberta, British Columbia, Ontario, as well as the two territories. And we're hoping to bring that across to every province. But if you live in those jurisdictions, it's certainly available by your family doctor or emergency physicians.
And so could patients who are learning about this here on the podcast then tell their family doctors about it? And that could be a way for these doctors to learn about this avenue that they may not have known about before?
Absolutely, yeah. So it basically reduces the time to get a dermatology referral by getting some consultation advice. It's totally free of charge. And the website is www.consultderm.com. But it should be stressed, it is just right now doctor to doctor or nurse practitioner to doctor. If you went in as a patient, you wouldn't be able to use it, but it is meant for patients. It's meant for doctors to clinically assist their patients.
Sounds like it would be like a really good tool for if you had a flare on the weekend and you couldn't get in to see your derm right away. If you did have to go to the ER to seek treatment, that you could suggest to the doctor who's in the ER to contact you, and that would be a great way to get treatment for HS, and you would be able to suggest what was needed instead of them going in blind. And I know a lot of folks when they have HS will go into the emergency department, and the first thing they'll think is it's a massive infection and want to put in an IV and start IV treatments. And I know that I had to come to you before and get you to take mine out because you've said like this isn't an infection that we need an IV. So having a tool like that would be really good to help navigate treatment when you can't get in to see a derm.
That's very true. It does save a lot of time and perhaps a lot of effort and even some pain associated with some of those unnecessary procedures. That's very true.
I imagine it's also a really kind of magnificent tool for people who live in small cities or away from any kind of major hospitals. We were speaking to a woman who was living in one of the territories who only saw a dermatologist once a year when they would come into their small towns. So I feel like that would be an excellent resource for them as well.
Yeah, not to mention cost saving too. So just the cost of taking time out of work and school or getting care for your kids or parents, et cetera, and the travel costs as well, right? And the cost of the system, not to mention. So it's been very helpful, I think.
Yeah, absolutely.
Mm-hmm. So
What
what originally inspired you to create Consult Derm? Did you have, that one patient who couldn't find help and you were like, oh, Eureka, let me create this awesome
Yeah,
resource?
it was more than just one patient. I used to actually go to the Northwest Territories after I graduated from dermatology residency. I used to go there fairly regularly, about once a month. And then after a while, my wife said, no, you can't do this anymore because we have a couple of small kids at the time. You need to be around. So reluctantly, I told the doctors up in the north, if you have any patients who need dermatologic assistance, please take some photographs as well as a brief history and send it to me by email. At that time, that was the only way to really do it. I'll take a look at it and I'll tell you what I think it is and how to treat it. And so this went on for about a year and a half. And then the government came to me and very politely told me that to stop and desist. You shouldn't be doing that because emails, of course, are not very secure and confidential or trackable. And they're quite right about that. But, we did that because that was a needs based thing. We had to do it at that time. So that triggered the idea of maybe creating a repository, like almost like an internet bank that would be very, very secure and confidential and trackable. So I thought of that, doing that idea. And then I went to our local programmers here in Edmonton and I said, here's the idea. This is what I'd like you to do. Please go ahead and program it. And they did, and went back to the government and said, hey, what do you think? Can we use this as a secure tool to see patients? And initially they said, no, you have to do more testing and we need to do some more studies associated with it, which we did. And we worked with the government to finally make a workable prototype. And finally in 2008, it was accepted in the Northwest Territories and Alberta. And it's been a great virtual clinic since then. We've then had other provinces come and ask us for assistance. For example, British Columbia, they don't have as many dermatologists as they should have or need. And they said, can we please use your platform? So I donated it to the government of BC, did it for Prince Edward Island. Now we've moved on into Ontario. And we also have a philanthropic arm for overseas, something called Telederm Outreach, where myself and some of my colleagues, we act as e-volunteers. We take a look at patients that are being seen by on-site physicians in Africa, and they'll send pictures to us and they'll say, hey, what do you think this is and how can we treat this patient? And to us, it doesn't make a difference whether they're next door or in rural areas or across the world. It looks the same to us, although the conditions might differ and the treatments might differ. And it's been a good thing for us as well. We use it for educational purposes. If we see a neat case, we'll show it to some of our trainees and we'll say, hey, this is how HS looks at different stages or in different colors of skin or different anatomic sites. And it's been just a wonderful thing.
That's amazing. I bet you've helped so many folks out there who, with this technology wouldn't have been able to get treatment, or it would have taken forever to get.
Well, you're very kind. Well, we consider it a really nice blessing, and we learn from it as well. So we're constantly learning about new treatments and new strategies, and this is certainly helping with that.
What first made you decide to get into dermatology?
Oh, that's a good question. Dermatology is a very unique specialty because we see all comers. So everybody's got skin and there's so many things that can go wrong with it. So I'm very blessed to see everybody from newborns up to senior citizens. So we don't just deal with geriatrics or peds. We don't just deal with women or men. You deal with both genders. And we also deal with different colors of skin. And it doesn't matter how rich you are or poor you are, all walks of life. It's just incredible. We could see literally everybody. That's one. So that's interesting. And if you're a people person and you enjoy talking to people and helping them, I think dermatology is a good choice. I certainly enjoy that. Also, I can work with my hands as well as with my mind. There's a lot of procedures that we do, minor and major procedures that are involved. And what's really cool is we work with technologies too. So laser therapy, there's a lot of other devices that we use for surgery. And it's really neat. From a medical point of view, we're basically internal medicine experts for external disease. So we say that the skin is a window to your soul. So we have to be knowledgeable about what's going on inside as well. And then there's drug eruptions, medication-related reactions, and so forth. So lots of things to know, and it's very, very visual. So if you do enough of it and you read enough about it, you can probably make a diagnosis extremely quickly, which is kind of nice. And so you never get bored. There's always something to do. And generally speaking, there's not too many dermatologic emergencies, so you can still have a little bit of a life outside and do a lot of other fun things like what we're doing today.
While we're on the topic of why you got into dermatology, we thought we would maybe ask about your most memorable cases and patients and who stood out in your career to you.
That's a really good question. You know, we do a lot of cosmetic treatments because the skin is often what people see. And, you know, as nice as that is, my most, I guess, memorable and noteworthy and maybe even rewarding experiences are with the people who are really sick. So one that comes to mind is actually somebody who has HS. Generally speaking, we see people with HS later in their diagnosis. So typically it takes years for them to establish the diagnosis. And it's really a neat thing and a great feeling to be the one to make that diagnosis for them, because they've been often misdiagnosed as having acne or folliculitis or another condition. And when you tell them, no, you know, you actually have a known entity called HS, Hidradenitis Suppurativa, and you educate them about it, you can see this huge relief, you know, and they say, wow, you know, I've been going through this for years without a diagnosis. The benefit of having that label means that now that we can understand it a little bit more. 2, they're not alone. And 3, there's so many great treatments that they didn't have before. So it's great to make the diagnosis, and then it's even greater to go ahead and treat them. They become some of the happiest people in the world. And you can see right before your eyes, they will change in their persona and go from being introverted to becoming much more positive about the world and more outgoing. And especially with younger people, I find it even changes their course of their life and what they choose to do and who they meet. And it's just a wonderful thing. I'm really appreciative of being in my role as a dermatologist.
It's so validating too, as a patient, an HS patient, to finally get that, you know, this is actually what it is. And like you said, it was, I know it was life changing for me when I found out that I like had HS, and we were able to go in there and start treating it and doing medications, and just having somebody tell me, yes, this is what is going on with your body, was just felt like a bag of bricks off my back, because it wasn't just, is this just me? Am I overreacting? Is like, I feel like because HS can come on and go so quickly, sometimes it's like a mental game. And, you know, by the time you get in to get your appointment, that lesion could be gone. And it's just nice to have somebody know and say, this is, you know, this is how it is, HS works, and this is how we're going to move on and treat it.
Yeah, and to know that you're not alone, right? I mean, the very fact that we have fantastic patient networks like the one you guys have, HS Heroes, is amazing. And now I can tell patients, you know, not only do we know what it is, but you're not alone. And there's resources to help you, not just physically, but also emotionally. So I agree with you. There's a huge psychological component that we can help to unburden people with.
Do you find that patients are coming in sooner, getting diagnosed sooner? Because I know for me, like I got HS in 2003. I didn't get diagnosed until 2012. Crystal, I know you have a similar time frame, but it used to take so long. So are you finding that time from onset symptoms to diagnosis is getting shorter and shorter?
Yeah, very much so. I think it largely has to do with education, and we really have to thank pharmaceutical companies. I know that sometimes they get a bad rap because, you know, people say that they're only into profit and so forth, but that's not necessarily true. In fact, a lot of the knowledge and education around HS, even caregiver knowledge, you'd expect our caregivers, including physicians and dermatologists, to know about it. We really didn't. You know, it was one of those things that when I went through med school, it was just a little line in the book, you know, and we kind of knew in concept, but did we really know about it? No. It was only when large companies like AbbVie and AbbVie came into to interest of this condition and brought it to the spotlight that we got to learn a lot about it. And then it even trickled down to other caregivers, for example, family physicians and nurses. They would see you and say, hey, you know what? I think you have this condition called HS. And, you know, I attended a talk by so-and-so, and I just remember something like that, right? And so really the diagnosis is being expedited. We're able to see people and diagnose them a lot quicker. And it's become something that was a frustrating condition to happier medicine now. So we talk about happy medicine, meaning that we have good treatments for it. And this is now one of them.
Well, and it was so hard too before, these medications were indicated for HS, because a lot of years they were indicated for everything but that. And I don't even know if you could go off label at the time and try and prescribe it. So I think that folks also need to realize that these companies, they put in the research. A lot of the times they put in the symposiums and the conferences, and they really do a lot of work to try and get patients the treatment they need.
That's right. And often they're quite philanthropic and generous. You know, if people can't afford it, or if their insurance company doesn't pick it up, they'll often cover the costs for the medications that we've seen. And I think it's a remarkable thing.
Yeah, I agree.
So you did mention laser therapy earlier in our discussion. Could you talk about maybe how laser treatment can help people with HS?
Sure, yeah. So lasers are remarkable. They're basically concentrated forms of light that can do a number of different things for the skin. One of them is they can get rid of scars, or at least diminish the look of scars, making them less perceivable and maybe even a little bit less painful. So generally, when we take a look at scars, we think of scars as either being textural and or color associated with it. So let's look at those separately. If you talk about texture, scars can either be elevated compared to the surrounding skin, or they can be depressed. If they're elevated, there's a lot of ways to flatten it, and that involves different types of cortisone and anti-inflammatory creams. Sometimes injectable cortisones will flatten things a little bit quicker. But what happens if they're indented scars? For example, scars on the face will often tend to indent. We call them atrophic scars. Examples include ice pick scars and boxcar scars. And really, there hasn't been great treatment prior to lasers other than surgery. Actually, going ahead and taking them off, we do something called dermabrasion to go ahead and aggressively smoothen out the skin. But lasers, since they were developed for resurfacing, have really changed the landscape, no pun intended, of the skin, because now they can smoothen the skin in a very, very safe way, and maybe even build tissue. So where it was indented, it'll become a little bit more even. The other thing lasers can do is for color of scars. So if you have a red scar, often the redness is due to blood vessel dilatation. Here we can have focused laser light that'll go into the skin and close those vessels down, making it less red. And with that, you often will have less tenderness and less pain associated with it as well. So I think for scarring, lasers are just second to none, and with very minimal downtime and not too many side effects.
Now, Crystal does laser treatment for her HS. Crystal, do you maybe want to explain a little bit about that?
Well, I do laser hair removal, but the main reason that they do it is for the inflammation, because the laser can go deep under the skin. And I was told that it's kind of like where if you used to do the IPL, that was like kind of like a grenade and it would go out. And with the news lasers, it's like a sniper. So it kind of just goes straight down and can help. And I don't really have much hair left anymore because I've been doing it for like 8 years, but I do find it really helps with keeping any new little surface bumps or bruises, and it really it's pretty like within 2 days I can notice the treatment starting to work right away, so it's fast and effective.
Yeah, Crystal, you raise a really good point. Sorry, I didn't mention that at all, but our knowledge we had talked about of HS has increased over time. And that one good example of that is the name. So the word hidradenitis means inflammation of glands. And that's what we thought HS was. We thought it was an inflammation of your apocrine sweat glands and how the immune system is somehow attacking it. As time has gone by, we've discovered that that's not necessarily true. In fact, it's probably the hair follicles and microscopic hair follicles that are responsible for inflammation that occurs. And it's that inflammation that causes the boils. So knowing that, if we can target the inflammation, specifically targeting the hair follicles, and diminish them or eradicate them, then that should also reduce HS flares. So a lot of times we do advocate laser hair removal. And for many, many people who have HS, it helps to keep those flares under control.
Yeah, it really does make a difference. I feel like that's what saved my underarms for sure without having to get a surgical intervention, because I just started doing it and doing it and doing it once we got everything under control. And it's I've never really had issues under there. And if I do, I go in for a Kenolog injection like immediately. And I always was like really impressed with the syringe that you guys use for your injections. Like I've never seen anybody else use it. I feel like you need to put a patent on it, but it's kind of like a spring loaded pen, so it really gets in deep.
Yes. So that's called a Ligmaject, Ligmaject. Ligmaject is a spring-loaded syringe, a little needle. So there's less pain and a little bit more force is delivered in a small amount of time. So you can get to boils and cysts a little bit easier. That's very true. You know, the other thing you'd asked about lasers for hair removal. So the ideal candidate for laser hair removal is somebody with light skin and dark hair, because laser works on the concept of contrast. So it looks for anything that's dark. If you had dark skin, dark hair, it's a little bit more challenging, but not impossible to do laser hair removal. You just have to use a very specific type of laser. If you have light hair and light skin, that becomes a challenge because the laser will pass right through the light hair. So ideally, you want to have a little bit of darkness and thickness to the hair in order to have good results.
I also find with the laser hair removal that like after having a bunch of deroofings and stuff, it has and even some of like from my lesions that have healed, it's picked up the pigment, and it's kind of like scabs up and crusted, and it's really taken a lot of my scarring and keloidiness away from my scars as well, which I thought was also a great benefit.
Yeah, the other thing people find that sometimes as a beneficial side effect is a slightly less sweating tendency. The laser seems to also stun the sweat glands that are within the region, so you have that benefit as well.
Oh, that makes sense. That's probably like when COVID first hit, nobody was able to go in and get these treatments for a while. And I was like, after a couple of months, I was starting to get like BO, even though I was showering. And I was like, where is this coming from? And once I started going back to get laser, it went away.
Yes.
So that I guess makes sense why.
Right.
Do you tell any of your patients like dietary? Because I think I guess like HS now, like you said, is like kind of an inflammatory condition which expresses through our skin in cysts and boils. Sort of like if we had psoriasis, it would express through like on plaque psoriasis or Crohn's and colitis, like digestive. So do you find that there's any food triggers, or do you think that it's more just an inflammatory situation?
Yeah, it's a really good point, and it's a good question. Unfortunately, I don't think it's true across the board regarding dietary influences. So I don't mention specifically to avoid anything, but I have seen this as a pattern. A lot of people do say refined sugars, and the reduction of that might be able to prevent flares. But if they have like a high sugar content, more than even a caloric content, it seems to be associated with flares. And I think that's been shown with similar conditions like acne. So people who have sugars, chocolates, breads, right? Things that are really high in their glycemic index. Some people, not everybody, but some people will have a flare. And I think you're right, it has to do with inflammation, and we just don't fully understand it. So for that reason, I tell people maybe just observe it, and it'd be more of an empirical thing. But there's no guidelines for that across the board. I mean,
Remember,
they
like,
did try to do it once for acne, but then people became a little bit malnourished. So you have to be very careful as a physician to say it without any clinical trial or proof.
I just remember like when I first got, even before maybe my diagnosis, like everybody was so heavy into the nightshades. Like, you got to go on the API diet, you got to give up the nightshades. And like a decade later, I think it's from sugar. I think it's from booze, like sugar and booze. And I don't think it's like from a specific food. I honestly think it's from the sugar, which triggers the inflammation as well.
Yeah, and remember, it's not, if it does help you, an avoidance of certain foods or even taking certain foods for that matter, It's not the cause. It's just an aggravating factor. So the cause is an inherent genetic tendency towards it, right? So there's still inflammation. It's just you might be able to reduce it to some degree.
I wonder if we could just touch back on, hair removal, laser and hair removal, and just ask you, when HS patients shave their armpits, groin, like sensitive areas, they do tend to flare. Do you have any kind of tips for hair removal for people who have HS?
Yeah, it's really challenging, isn't it? Because the problem is how you do it. So if you're doing traditional forms of hair removal, for example, shaving, it can actually lead to some significant problems because as the hair grows out, it can sometimes push into the skin. So even if you have a little bit of microscopic ingrown hair follicles or you have sharp hairs that are pushing against the surrounding skin, that could trigger an HS flare for sure. Remember that anything that touches the skin is going to potentially traumatize the skin on a microscopic level. And if HS is a inflammation of the skin, that means that it's prone to that. That means any type of irritation that you have could potentially alert the immune system to come there and set off a flare. Keep in mind, the immune system does not want to hurt you. It wants to protect you. And all of this, including HS, is supposed to be a protective mechanism. The immune system is going there to try to protect you against something, which in this case happens to be the irritation from that. So doing certain forms of hair removal may in fact exacerbate it. I would suggest maybe if you're going to do hair removal, do things like laser because it's less injurious to the skin. I mean, there is a little bit of trauma, no question about it, but there's ways around that. I mean, even with cooling and with the type of laser one does, and afterwards using good moisturizing, soothing creams that can help to reduce that initial event. But overall, it's a lot safer and less traumatic than, say, stripping of the skin, waxing, and definitely shaving.
So would like trimming, if you got a trimmer, be a good option? Maybe not going down to the skin surface, but enough to keep.
Yeah, that would be certainly better if you had a little bit there, but then that's often undesirable for a lot of people. You're right. It's just challenging overall doing the razor.
And I've seen like a huge uptick in estheticians really pushing sugaring and waxing for HS. And when I went to school for aesthetics, we were told if you were prone to cysts and boils, you were contraindicated to be a candidate for shaving and waxing. So it's like blows my mind to see all these people suggesting it when they, a lot of times you have open wounds. I think that it would be traumatic for the skin.
Yeah, I agree with you. I think people just don't realize that HS is in fact an inflammation and that the skin is very prone to becoming excited when it's irritated. And certainly you're right, sugaring, waxing, all of that irritates the skin. You have to be very, very careful.
Well, and if you have an open area too, and you go to a place that's double dipping or, not being the most sanitary, you're opening yourself up for infection too, because you have an open wound.
Yeah, that's true. That could be a portal of entry for bacteria and other organisms as well. Yeah, we have seen that for sure.
We had a patient write in and ask us about zinc supplements and how those can help with HS. We were hoping you could explain a little bit about that.
Yeah, it's a good question. I don't think for HS, frankly, it helps a lot. So most people already have a good complement of zinc. So zinc is an element that's a cofactor for metabolism. So you need to have zinc in order to have a healing response. And if you're deficient in that, then you're unfortunately not going to heal very well. So, but the good news is most people will get the correct amount of zinc that they need. You don't need a lot. You just need a certain amount, which is very small, and you get it through your diet, which is usually pretty good in North America. Where we start to see zinc deficiency, there's a condition called acrodermatitis enteropathica, big long name. Acrodermatitis means you get an eczema like rash on the distal extremities, so the hands and feet, and sometimes in the bum region. And you get that because, and also in the gut. And you get it because you're being malnourished. So we see that with people who are in the hospital on something called TPN, total parenteral nutrition, where they have to eat out of a feeding bag. They get an IV nutrition. Sometimes if that doesn't have the appropriate amount of zinc, then you'll be a sitting duck for this condition, in which case you can get a almost like an HS-like picture, not technically HS, but similar to it. So, but for most people, 99+% of people who have normal zinc, taking more zinc isn't really going to do too much more.
Is there like a certain period of time you can be on zinc? Is there like you do 3 months and then you have to be off of it for a while? Is it easy to OD on zinc or get too much zinc?
Yeah, that's a really good question. So there is what we call hypervitaminosis. So if you take too much of any kind of vitamin or cofactor like zinc, it could have negative consequences. With zinc, I'm not sure if I've ever seen a case of excessive zinc, because it's really not necessary. So most people aren't taking zinc supplements. They might be taking it along with their multivitamin, but generally taking excess is not advisable, just because it could have other side effects that we just don't know.
Yeah, like it upsets my stomach.
Yeah, at very least it could do that, but it might even be doing other things too. I know I can't speak for zinc, but similar cofactors like iron or even copper, if people are taking too much of that, it can deposit in their joints and they can have joint stiffness, pain, arthritis, and it can even discolor their skin, believe it or not. I don't know if zinc's the same. We've seen that with silver. We've seen it with gold supplements, where people take on like a bluish gray, brownish hue that it not only doesn't look good, but it can also be quite dangerous. It can make them photosensitive.
I wanted to ask you about iron, because I myself have iron deficiency anemia. And is this something that's common among HS patients?
You know, it may be. I think it's just common in general for women, but I don't recall seeing any studies seeing it correlated specifically to HS. But I think it's just common all around. Women generally, more than men, tend to be running a little bit low on iron, and I think iron supplementation is not a bad idea. Some of the signs and symptoms include even hair loss. People can even have constitutional symptoms, weakness, fatigue, that type of thing. So definitely, I think everybody should get their iron checked, but particularly women, I think.
Do you know of any new treatments coming up? I know that we've heard about like JAK inhibitors, maybe coming down the pipeline for HS, and maybe just
Yes.
some of the other medications you use. I haven't heard anybody talk about like Accutane in a long time, but I know when I was using Accutane, it like really dried up some of my lesions that wouldn't continue to heal. And so I didn't know if that was still an option for folks or not, and just kind of some of the new things that are coming out to get excited about.
Yeah, absolutely. You know what? It's actually the best time ever to have HS, because not only there are good treatments right now, but there's going to be even better treatments. I'll start maybe with the best treatments. The best treatments are the ones that are targeting the immune system, specifically that part of the immune system that causes the inflammation that we know as HS. Leaving everything else fine. So these newer agents, some of them you probably already know, the biologics. So the only biologic that's currently available commercially is called adalimumab. So we had Humira, and now there's 9 biosimilars to Humira. So if you can imagine that, so 9 forms of adalimumab are out there, which is great, and they're all there to help you with your HS, which is great. And they target just that specific part of the immune system that causes HS, leaving everything else fine. So you still can fight infections and prevent skin cancers and other forms of cancers. It's still very, very, very safe. So that's there. Now, other companies are trying to create other biologics that target other molecules that are contributing to the HS pathway of development. And these are just on the horizon. In fact, they're being tested right now, and some of them are just remarkable. So look out for that.
Are those IL-17s? Sorry, is that
Yes, yeah, anti-IL-17s is a good example of one. Yes, and there's several of them that are available. There's at least 3 that are available in the market, but they don't have that HS indication. They haven't been studied for that. What that means, it doesn't mean it won't work. It just means that you won't get coverage for it if you tried it. You won't get insurance coverage. But once you get approval, then the insurance coverage will be there for you. So they're coming. And then you talked about these JAK inhibitors, and that's very exciting. So JAK inhibitors are pills. So they're not injectables. The biologics are injections. These JAK inhibitors are small molecules that can actually go into a pill form. So imagine treating your HS and preventing your HS by using a pill. That is definitely on the horizon. The clinical trials are taking place right now.
And
So
not having to go into it for an infusion or an injection once a week would be.
Yeah, for some people that would be marvelous, right? The other things that are there are basically designed to treat what is already currently there. It doesn't prevent it. So we talked a bit about antibiotics and Accutane. Accutane does work quite well at reducing inflammation. It reduces boils and cysts. The problem is it can be quite harsh, for sure. Very drying, as you correctly said. The other thing is there's different forms of isotretinoin, which is what Accutane is. There's a new one called Epuris, Epuris, which is the Accutane molecule. But what they've done is they've encapsulated it in a lipid sphere microscopically. So when you take it, it absorbs so nicely. So you have a predictable result, and it's a lot safer, I've found, than the Accutane brand. So if you are going to try something like Accutane, that would be the choice. Then there's antibiotics with anti-inflammatory properties. So doxycycline and minocycline, tetracyclines are there. And there's even new creams that are available to help to dry out some of the boils and pimples that you might have. So the one that comes to mind is called Aklief, Aklief, is a topical retinoid cream that works quite well. There's another one called Arazlo, Arazlo. It's a topical cream that will dry out the pimples. So just remarkable. You should definitely see your doctor about these. They can help to, well, along with your topical treatment, your oral therapies together might work well in combination.
Can I just ask about metformin? Like, I'm on metformin. I know a lot of people are, but I don't quite understand exactly what properties it has that helps with HS.
Yeah, so metformin has been used traditionally for diabetes control, but it's been found to also help with other forms of hormonal control. So sometimes people who have polycystic ovarian syndrome or other hormonal dysregulation issues can help to regulate it a little bit better using metformin. It's not officially indicated for that, meaning coverage might not be there. The clinical trials haven't taken place, but for a long time, doctors have seen that it does help.
Is that similar to spirolactin, metformin, or different?
No, it's a different medication, but even spironolactone is more of an androgen blocker. It's a hormone blockade. So it acts like a shield against the hormones and the skin. Whereas metformin, I think, helps to decrease or mitigate the hormones and how they interact with the skin directly.
So only women can take spironolactone, but women and men can take metformin?
That's correct.
So the way I was explained one time about a TNF blocker and an IL-17 is they kind of told me that, like, imagine like a waterfall and a dam, and so some folks will get a TNF and it'll kind of like detour some of that waterfall off, and if that doesn't work, they've tried like an IL-17, like a Stelara. I know it's not indicated for HS, but I do know some folks who are off label on it or in the States. And that kind of, if it doesn't block one little stream of inflammation, that other one might block the other one. Is that kind of like how that works?
Yeah, it's probably even more complex than that. I mean, as we learn more about it, we know that there's these different molecules, different players.
The interleukin?
Yeah, they're called interleukins and other cofactors, and they all come into play. Like, so for instance, if you wanted to block a dam, you need to have the beaver, you need to have the wood, and you need to have the stream, right? And so all of these kind of come into play, and these different agents block different parts of it, and thereby allowing the stream to go ahead and flow. So that's probably a better analogy as time goes by, but. Yeah, the science we have remarkable. We have to really thank the scientists, because over the past 10 years, they've really understood this a lot more and made very quickly these medications to safely block all of this. If you came 10, 15 years ago, we didn't have any of this stuff.
No.
We'd have to rely on our Accutanes and our antibiotics alone.
Yeah, there was nothing, like, even, going to Google and like find stuff. Like, I know when I was searching for answers, I got lucky to find you from a med student that said, because I first got sent to a gyno, and she came in and she said, I know this doctor. He is into all kinds of wild stuff. Like he treats people all over. And she said, if anybody's going to know what this is, it's going to be him. And I was just so grateful because there was nothing until I came to you and you said, hey, I know what this is. And that was life changing for me. Like, it changed my life.
Oh, I'm so pleased. It's been great from the other end. I mean, when we used to see HS patients, our goal at the end of the day as physicians, especially if you're a good physician, is to help your patient. And when you can't help them, it's just such a letdown for us as well. We feel so bad because we just didn't have the knowledge or technologies to do so. Now, that's not the case for HS. When you come in, I'm actually extraordinarily happy, maybe even more so than I would with other conditions, because we can educate and tell people that, this is your diagnosis, this is what you can do about it, this is what it is. And then two is we got some amazing therapies for you. And even if you can't afford it, that's okay, because now these companies, as I mentioned, are so generous. Through our influence, we can probably get drugs to you for free in a very, very safe, effective way. We can give you your life back.
Absolutely, especially with the biosimilars and having more options.
Yeah, amazing times.
It really is. And I used to think mine was so bad because I didn't have a diagnosis for like 20 years that I lived with hiding it. And it's so amazing to see folks, who are young or who are older or whatever age, go in and say, hey, I thought I was going to have this for the rest of my life, and to get treatment. And it's just amazing because it's something you will live with forever and have to work towards keeping maintained, but it's possible to get your life back and to get your body back in control.
100%. And, it often inspires people to do other things. So, back in the day, we used to say, if you had somebody with HS, just tell them to lose weight, and that's such a cop out and letdown. And I always felt bad about that. And it would state that in our literature and our textbooks, right? Now, of course, it's going to contribute, because then you're going to have greater inflammation, skin rubbing against skin. But it's such a demoralizing thing to say that without, showing people that there's other ways to treat it. Now, I find that people who are put onto biologics and pretty soon these JAK inhibitors, they're so inspired because they got their life back. The tenderness and the pain is gone. The stigma is reduced. Then they often better themselves. I've seen people lose a lot of weight, not because they've taken drugs, but because they've gotten out there. They're much more active. They're watching what they're eating. They're a lot happier with themselves. And it's just a remarkable thing.
I agree too. And when you're not in pain, it's easier to get out and do things. And I think, with a lot of the research that has gone on, they found, obesity is a comorbidity of HS. And a lot of times it's not your fault. You don't have HS because you're overweight. I know I had a doctor tell me that I had bad hygiene and that I needed to take bleach baths and start like cleaning myself better. And I was like really ashamed by that because I thought it was something I did. And that's why when I finally saw like you who knew and said, this isn't your fault, you haven't caused this, also took a huge burden off of me because like I knew I wasn't dirty, but then I was like, well, am I like,
Oh, right. They put it in your head, right? The other great thing I found is I've learned throughout this process about biology and a little bit about medicine as well. Is for example, I've had patients who had the worst cases of acne, like really cystic acne. We put them on several courses of repeated Accutane and the new one, Epurus. They got better temporarily, and then it got worse again. Turns out that they had HS. So when ultimately they came in not complaining about the facial or truncal acne, but about boils in their groin as well as under their arms, we put them onto Humira, adalimumab, and then they cleared there, but their skin also cleared elsewhere. And I got to thinking, wow, there must be a great a variant of acne that is associated, is actually HS. And so we've learned that sometimes Humira can help for really stubborn acne too.
Well, and I feel like everybody always just said like HS presents under your arms, under your breast, in your groin, and in your buttocks. And like now we're finding out like I've had huge areas of the back of my head removed where I've had HS and on my neck. And I've seen folks with it in their arms and their legs. Like it kind of can appear all over, I think, other than maybe the soles of the hands and feet.
Yeah, you're absolutely right. Yes. And actually, you made me think of something else as we're chatting about it is carbon dioxide laser therapy. So we talked about resurfacing the skin and any scars there. One of the things that we started doing just only 2 months ago is actually removing cysts, like de-roofing cysts, by using the CO2 laser, which is great because it allows for faster healing. There's no blood loss. There's no blade required. We're just using the laser to do the cutting. And it's been remarkable. So like that, I think that there's going to be newer innovations for treatment of active HS, but also for prevention.
Do you have any videos on that? I would love to see that
Yeah,
procedure.
I'll share one for you for
Yeah,
sure.
just from, having de-roofings to see that, that just sounds so interesting to me.
Yeah, because a laser, as it cuts the skin, will also sear the skin, so it
Yeah.
cauterizes it. And it's just a remarkable thing. I'll send that to you.
Yeah, because like the de-roofing, they'll freeze and then they cauterize afterwards. So there is like a lot of blood and stuff that I know one time I looked over at the table and I was like, whoa, like eyes up ahead.
That's
So
right.
that's really neat. And what is the healing like with that?
It's very, very good. We let it heal by secondary intention, so we don't have to put any sutures in. It is open for about a week. We just pack it, and similarly do a de-roofing procedure using a blade, except as you correctly said, there's no need for cautery.
That's amazing.
Yeah, I'll
Have
send you
you
some.
have you seen how they use like ultrasounds to see like how deep the lesions are?
Yes, so you're right. That comes under diagnostic technology, just to determine and outline how bad is the disease, how deep does it go, or is there even a sinus tract, meaning it starts here and then it drills itself and opens up over here. So all of that can be determined by ultrasound.
Yeah, I know I've had de-roofings and we've gone in and thought there's like nothing, it wasn't much, and like then the next thing I know they're like, look, we can stick our whole finger up there. Like they just didn't
Yeah.
realize that it just kept going in that soft tissue. So I just wondered if that helped, so that you're not going in blind and you can kind of see how.
Yeah, it most certainly would. And also to avoid any critical structures. So if there's any nerves or blood vessels that are there that you don't want to necessarily hit, then you can do that with ultrasound.
Have you ever seen it like attached to the bone or anything, or is it basically just stay in that soft tissue area?
No, I haven't seen it to the bone, but I've seen it quite deep. So we have the skin, muscle, and then the bone. So it won't go beneath the muscle, but it'll go pretty close.
And if it did, would you have to send that person to like plastics to get, well, you
Um,
do
Normally
plastics,
you
right?
would, but yeah, it depends on one's training. So yeah, I'm fortunate because I did a fellowship in California. I can do a little bit deeper than a
Yeah.
lot of the dermatologists. But yeah, I mean, the good news is we have a lot of help, and there's a lot of good dermatologists and plastic surgeons across the country who really they love doing this kind of stuff. It's actually, from our end, it's a fun procedure because we can see people being happy at the end of it all. It's a
Yeah.
really neat thing.
Yeah. I know like when Dr. Keeling does them, like when I first started, he used to like play his like heavy metal music and like get all excited about it. And I was like, you really like doing these surgeries.
Yeah, that's right. That's right. It can get quite fun.
Yeah. But I guess because you see, I know I'm someone who like really likes to see results. So when you do a surgery like that and you get like such a big result, it must be like really satisfying, not only just for the surgery's sake, but the patient's benefiting as well. So I can imagine
Absolutely.
how gratifying that is.
It's extremely gratifying, and it makes it all worth it for sure. And I just wish we had this technology 10 years ago. Millions of people would have been they could have avoided some of the harshness of the condition. But here we are. It's not too late, and certainly it's the best time to have HS.
It really is. Like I know some folks get like upset because it might take them a year to get in, but like Stephanie and I always say, like, you're so lucky that you're not living in the States where you have to decide like we went to a conference, and the first thing they said was the first decision you make with treating your HS is, can you afford the treatments? Where here it might take a little bit longer to get in, but everybody is going to get the same sort of treatment.
Yeah.
And it's, yes, you're waiting a year, but it's so worth it because, like you said, the surgeries, the medications, the all the methods that we have now, it just makes it so much, it's worth it to go.
Yeah,
And
and the great thing is, I'd like to say that Canadian doctors are awesome because we're very philanthropic, and we like our patients. It's not necessarily true in other parts of the world, right? And so I think what you're doing with HS Heroes is remarkable. You really have to be commended. Congratulations on everything that you guys have done. Maybe we can set up a network of like-minded doctors, dermatologists, and plastic surgeons to see people quicker. I
that would
certainly
be
would have
amazing.
no problem if anybody had HS and they came to me. I would expedite the consultation. And it's easier for us to do that. It's not like it would take a lot of time where it used to 10 years ago. Nowadays, we have very, very established and successful pathways. So it doesn't take a lot of our time at all, but you do need us to go ahead and trigger the insurance policy to cover some of the meds, because I think some of them have to be from authorized by a specialist.
Special authorization.
Yeah, so for that reason, either by telehealth, or perhaps if we can get together a network of like-minded specialists, we can see people really quickly.
I think my biggest concern that I see with patients is, um, we talked earlier how a flare can come and go, and if you're in so much pain, what do you do on the weekends, or what do you do if your doctor's out of town and you can't get in? Like, what do you suggest to your patients to do in the meantime?
Yeah, you know what? You're right. It depends where they are. So in a big city, I mean, one of the things they could do is just if they went to the emerge, that I guess we need to train the emergency doctors what to do. They can either do an injection. They talked about Kenalog injections just to reduce the inflammation, maybe as a quick fix. Or if they're so inclined, we could even teach them how to do a de-roofing of the problematic lesion, and then send them to us. We can expedite a consult to do the full lesion removal, even within a week or two.
Is it annoying for them to go in and do like an incision and drain and then send them to you for like a surgery? Like, if someone's in so much pain, would you tell them not to do that? But like, the one thing I see, and I know Stephanie can agree with me over and over again, is the minute an HS patient goes to ER, they put them on intravenous IV for antibiotics. And
Maybe that's a project we should do with HS Heroes, right? And is to try to educate the emergency doctors. And I don't blame them. They just don't know, and they're just so busy. But if we can manage to get their time, even for an hour or two, and try to train them on how to do this, I think, and we show them, in fact, this will probably help them because instead of taking so long with the patient, now they can do it a lot quicker, more
yeah,
efficiently, right? So maybe that's a project we should consider doing.
I would think that would be amazing. I know another thing is, like, when they would do incision and drain, sometimes they would get like upset because the area would be so inflamed. They would expect it to have like so much liquid and pus and blood. And when they got in there, there wasn't really a lot of that because it was just inflammation. And I think that like stumbles a lot of ER docs too, because they just don't understand why this isn't a normal cyst.
You're right. And so we can train them that there's a difference, there's a spectrum, right, of disease, and then also what to do medically, right? I mean, which medications to give them. Sometimes it's useful if the emergency doctor or family doctor puts you onto doxycycline or tetracycline, not necessarily because it's helpful clinically, but because it will qualify you for more advanced medication. So often your insurance plan will pay for Humira, but you have to have tried doxycycline first, and only then can you go. So this saves a lot of time.
Yeah, you
So
have to fail a round of antibiotics, right?
right, and so we can teach them that, which antibiotic to do, what dose, how long, that type of thing.
Yeah, I think that would be amazing because, like I said, I know things have just really gotten, we've really just gotten HS like new technology in the last 10 years, but I know, for years and years, nobody ever even suggested going to a derm. I was just told it's basically like your diet or you're prone to these. And it would be so nice to have someone say, hey, we think this is HS and here's what we're going to do next.
Yeah. No, we can do it. We have the right people involved. We have both of you. You guys are awesome. And we certainly, from our end, I know many people like myself who'd love to volunteer to do this.
That would be amazing.
I think maybe this is a good place to kind of close off the podcast episode. Dr. Rao, do you maybe have any comments or well wishes for HS patients who might be listening?
Yeah, just to say that again, you're not alone. We have a lot of people who are suffering from HS in Canada, and fortunately, we know a lot about the condition more now than we ever have in the past. We have a lot of support. You have support medically from specialists and surgeons such as myself, and you certainly have good role models and people advocating you like Stephanie and Crystal to help you, and also companies, the ones that make these great medications. If you can't afford it, they will give you the product because they want to see you doing well, and they can certainly afford it. They're doing quite well, as you can see, as you probably know. So they do give back equally. So definitely, if you think you have HS, or even if you do have it, go ahead and do see your physician. Might send you to somebody like me, either directly or by teledermatology. Will be able to assist you a lot more. This is the best time ever to have HS.
Oh, thank you. Thank you everyone for joining us today. And a very special thank you to Dr. Rao for speaking with us and lending us his valuable expertise. Join us next month for another episode of the HS Heroes podcast. Until then, remember, real heroes don't wear capes.